afternoon and happy Tuesday, friends. And thank you for joining me again this week. I have my friend, my chairman of the board of the Daytona Regional Chamber of Commerce and the executive VP of Brown & Brown, Mr. Bob Lloyd. How are you?
I'm well. Thank you, Carmen. I appreciate the invitation to be with you.
Well, I appreciate you joining us. So we have an interesting topic today.
Yeah, one that I'm a little familiar with. So I think we're all a little familiar with.
Well, I really appreciate your time. How's your 2020 been?
Oh, it's been very exciting. I talked about in 2019 at the end, in anticipation of my year as chairman of the chamber. I said it's going to be a year of change, and I promised that. But I can tell you, I had no real inkling that it would be this kind of change. So I think I want to take back my pledge in 2019, but it's too late now.
Tell us a little bit about what that was like. You succeeded Randy Dye, and you will be you are our chamber chairman for 2020. What was your vision 2020 starting the year?
We had a lot of things, really positive momentum, and some real challenges ahead of us. But going back to where we were, the market was strong. Unemployment was less than 3%. It was the most dynamic and robust economy that we've seen in quite a long time. And so, hey, it was optimistic, and we were looking for some things to happen in our own community. If you look at what was happening with East ISB and the progress we were making there, and the Brown & Brown headquarters in downtown Daytona Beach, the Mary McLeod Bethune Statuary Project, saving the Tortugas, saving Bethune-Cookman University. Lots of things were happening, and we were on the cusp of some really dynamic change for the good in our community. And my real goal all along was to create career opportunities in Daytona Beach, not just jobs, not just minimum wage jobs, but career opportunities for our kids and grandchildren, so that kids that graduate from high schools in Volusia County could have a reason to come back and make their home and make their careers in Daytona Beach. So we were on a great track in January and February, and then something happened that kind of changed our focus. A lot of those goals, though, Carmen, are still ahead of us. And so, look, some of the projects are still moving ahead. The East ISB project still moving. The Brown & Brown headquarters will still open. All of those things are still, we've got to keep, our hopes up and optimism. And I still believe that those things are ahead of us. But we've had a major kind of speed bump. And, our primary focus right now, our goal is to make sure that we protect businesses that are trying to survive the COVID-19 pandemic, to keep them functioning, to keep them in existence, to get through this so that we can get to the other side and get back to our ambitious goals.
Absolutely. And of course, we're talking about COVID-19, right? COVID-19 happens in mid-March. And I don't think that anybody expected something at this magnitude, or for us to still be dealing with it come July. Right. And a lot of the conversations, once we got through the PPP loans and the EIDL loan conversations, then there's the very real reality that we have to get back to business, right? So the Chamber of Commerce has promoted back to business safely, and we're one of the businesses that, and I know that you guys are as well, that's promoting opening our doors safely for our community here in Volusia County. We want to be the example of how to open up a community the right way. And one of the things and one of the reasons why I wanted to have you here today was the talk of liability. It's not the sexy subject, right? It's the hard conversations. But the reality is, as business owners, especially brick and mortar, we have assets and we have this baby to protect. And how do we do that without really putting ourselves at risk and without really knowing what the whole scope of COVID-19 is? So before I get started, I do want to say we're not providing any legal advice today. This is strictly a one-on-one, and we're sharing experiences and knowledge. So I appreciate your time in doing that. But we're not giving any legal advice here today for obvious reasons. But we do want to talk about the right data, and we do want to talk about the liabilities and how to protect our business. And there is so much information coming at us. Chamber of Commerce has done a great job of filtering some of that information. But I know that you have some data that you'd like to share with us to kind of get this conversation rolling. So.
Sure. Well, thanks again. And I appreciate that. I hope that when Carmen, you mentioned that I was both a lawyer and an insurance agent, that people just didn't turn off their computers. So I'll try to make this as interesting as possible, but it is, it is an important subject for anybody in business out there right now. And so, the data is important. And I think from my perspective, I said this back in March when things first started happening. I said, choose your news. And really what I was talking about is make sure that you go to the source of the data and really look at the data yourself and try to make that any decisions that you have based upon that reliable data and your own interpretations based upon expert advice. And so, when I look at what was coming from the CDC, originally what was coming from the WHO and from the departments of health around our state, really I started looking at their data and then relying on what was coming from the Florida Chamber and from our own chamber, the Daytona Regional Chamber. It's so important there's great information posted. I ask you all to please check it out for yourselves and make your assessments of that information. I just wanted to give a couple of things about the data, and this is as of today. So there are 441,977 total cases in Florida. And so if you look at that total number of cases, we also have 3,038,322 negative tests. So the number of negative tests, when you think about the number of positive tests that's blasted on the front page of the paper and all over the media, you have to also look, the number of negative tests have gone up as well. And we're testing about 16% of the Florida population. So Florida's population as of the end of 2019, 21,480,000. So we have a population of over 21 million people. And so you look at the number of tests that are being performed. It is a good thing that we are testing, but inevitably you're going to find more of those results. Now, am I trying to say, hey, it's not as bad as everybody says it is? That's not the case. What I'm saying is if you look at that data, we are testing more. And if you think about the number of positive tests that we have out there, you also have to factor in by probably a factor of 10 to 15 the number that are not getting tested out there, but have COVID-19.
Right.
So I think it is, again, we're dealing with a virus, a pandemic that is highly transmissible. And so, this is something that, again, is going to caution us in how we open our businesses and what we do there. So, what's the most important data? Do people really want to know how many people have been exposed to the data, to the virus? Is that the most important thing? Or is it really to make sure that we're not overwhelming our hospital systems and emergency rooms with hospitalizations from COVID-19? Is it to prevent fatalities and to reduce the mortality rate? And so when you really think about it, do I care that I've been exposed to COVID-19? Yeah, kind of. What I really want to avoid is going to the hospital, being put on a ventilator, and potentially dying from COVID-19. So when you look at those numbers, that's kind of the real clincher. And so hospitalizations in Florida, there are, according to the Department of Health information, 24,917 hospitalizations. What's not in that number, though, is the number of discharges. So it only gives kind of the number of admissions, but it doesn't give you the discharge information. So it's not telling you how many people went to the hospital, stayed there a day or two or three, and then went home and have recovered. And so we have to pay attention to that as well. So the total hospitalization rate is not necessarily going to give you all of the picture. So that needs to be watched as well. In the death category, nobody wants to talk about death, or more importantly, everybody wants to go to heaven, but nobody wants to die. And so if you think about that, it's the topic probably that lurks around in everybody's mind, but nobody wants to really talk about it. So as of today, there were 6,240 total deaths in Florida recorded by the Department of Health. And if you look at that number, that's pretty staggering. But again, compare that to a population of 21 million people, 21.4 million people. It gives a perspective of really the mortality rate related to the virus. And by comparison, we had 6,200 deaths, total deaths in Florida as of today. In Queens, which is a single borough in New York, there were 5,940 deaths, according to Johns Hopkins University. So almost as many deaths in a single borough in New York as the entire state of Florida. And out of those 2,811 of those deaths were in Miami-Dade, Broward, and Palm Beach counties. And then you had Miami-Dade ranks third in the number of cases, according to Johns Hopkins, with 107,315, but 18th in mortality. So what Governor DeSantis has done in attempting to do, and again, I know he's taken a lot of criticism lately. Florida is, getting a lot of flack out there in the news media. But if you really think about Florida, what we've done is protect the most vulnerable, take those that are in nursing homes, and if they have to go to the hospital, he set up nursing homes that are specifically for COVID-19 to help them recover, but protect the most vulnerable, try to keep businesses open, try to restart our schools, and handle this in a responsible way based upon the data. So if you look also in the nursing homes, let's talk a little bit about that because it's made big news in Volusia County and it's big news in Florida. More than half of the deaths in Florida are in nursing homes. And so if you think about that, the vulnerable population that we have in Florida, and we have a lot of nursing homes in Florida, that's a big concern, and it's important for all of us to make sure that we're doing what we can do to be responsible. So that is, that's kind of the landing spot on the data itself. And I just wanted to kind of say, I want to level set and say that's the important things that you need to look at, but always choose your news, focus on the data, and make sure that you're making decisions with all of the data in front of you.
Absolutely. And the Chamber of Commerce on their webpage has access to all of this information on their back to business safely. And so does the Florida Chamber of Commerce that we get a lot of our information from with the Daytona Regional Chamber. So you can always visit that website, keep yourself informed and educated so that you know how to debrief a little bit of the information that we're just getting. We're on information overload. So I really appreciate you going over that. So when we look at that and we are talking, the numbers really don't look horrible in Florida. But what we do know is that we know that Florida is very high when it comes to lawsuits. I think it was ranked number 2 or number 3 in the US as far as the amount of lawsuits that Florida processes. So knowing that we are high in liabilities like that, what would you say we should be doing today to avoid that kind of litigation and liabilities?
I think, again, when you're balancing the risk in a pandemic, and I would say this for our businesses out there, our business owners, and I would say this also for Governor DeSantis, it's not like he looked around, reached back on his credenza, and pulled out the manual for COVID-19. Oh, this is step one. This is what we need to do next. These are the dates on how this is going to progress. The same thing. And so, when you have government reacting to public health information, they're looking at the data that I just described, trying to make the best decisions from a public health standpoint, from a medical standpoint, a clinical standpoint, a therapeutic standpoint, and they're going to make recommendations to our public officials, our public policymakers. And so, our Constitution, the way it's set up under the Fourth Amendment, those powers not given to the federal government reside with the states. And the same thing at the state level, a lot of the decisions are going to be local decisions made by cities, by counties, in how they are dealing with the public health crisis as it affects that local community. So when we talk about liabilities for businesses, the last time I checked, I think there are about pending right now 301 lawsuits pending against arising out of COVID-19. So it's already started, and Florida, certain places in Florida, including the entire state, it sometimes has been listed as a judicial hellhole. Not the most kind moniker, but we do have a very active plaintiffs bar, and they are going to jump on this issue for sure. For businesses, I think you have to kind of stay out in front of this and say, what's the risk? What are you balancing in order to stay in existence, maintain your payroll for your people, but protect customers, protect your employees, and you're going to have to balance through those things. And there are some businesses that are going to decide that the risk is too much. But I think when you look at providing the safest environment, both for your employees and for your visitors and customers, that becomes a challenge, and it depends on the kind of business that you have. In some businesses, they found that going to a remote working environment is working okay, that they're able to continue and they're able to serve their customers and clients in a remote working environment. So their decisions on how to reopen or to change their workspace or their workplace may be different. They may be saying, well, we never stopped working, we're continuing. For a restaurant or a very a client-facing, a customer-facing retail operation, that may be a little different. And so their liabilities may be a little different. So, I have to say it right now, this thing, and no, it's not a diaper. We all know what it is. And there's been great controversy about PPE and whether to require it of customers, whether to require it of employees. And it's easy to say that the data, again, turning back to the science, is pretty reliable that wearing a face mask, exercising social distancing, and washing hands frequently significantly reduces exposure to COVID-19 and transmission of COVID-19. So if the choice is between PPE or closing your doors under a government shutdown mandate, I'm going to wear the mask. I'll wear it all day long if I have to, in order to keep businesses open, and in order to keep payroll flowing, and in order to keep your receipts and businesses operating in a profitable manner. So those are just some of the things that it's confounding, really, when you think about the objections to it. And I'll put it very simply. Your First Amendment right to wear what you want, when you want to wear it, and not to wear a mask, that's fine. You're exercising your First Amendment right. And what you're going to end up causing is a Fifth Amendment taking of the business because they're going to get shut down like bars have been here in Volusia County and across our state. And it's unfair to them. We ought to do what we can to make sure that they stay open, that they stay profitable.
That's perfect. I agree. We actually, we have a shield up front, we have masks, and we have a hand sanitizing station. And I encourage all of my friends that own businesses or colleagues, and even some of my customers, that, hey, there are plenty of programs and civic organizations like the Chamber of Commerce that are giving away PPE. Have it there, use it. I require my staff, when they're working with a customer, to come up with the mask. If the client doesn't want to wear a mask, we respect that, but we try and make sure that we can minimize any exposure that they may have. And also, we have some staff that have some immune compromised family members. I have immune compromised family members, so I want to make sure that I can go home and go visit and make sure that everybody's safe. So I agree 100% on that. How do you believe that COVID-19 is going to change the way that we protect our assets? Sorry.
There aren't a lot of protections out there for, how COVID-19. Obviously, there's been great discussion about insurance and whether it would respond to COVID-19 or a pandemic. And in most insurance policies, it's excluded because of back in 2008 or 2009 with the SARS pandemic. A lot of insurance companies put that in place because it's impossible to underwrite and figure out what an appropriate premium is for that kind of risk. And so, that's sort of the evolution in the insurance policies. I'm not sure if that'll stay that way. There may be states that will require coverage for pandemics in the future. And so, that's a possibility that you might see certain states that require it. Then again, insurance companies have the right to choose whether they want to do business in a particular state. So I think this is going to be a situation that's going to be greatly debated into the future. And again, if you look at pandemics in history, even going back to the Spanish flu pandemic in 1918 and 1919, which is the closest comparison to what we have now with COVID-19. Back then, there were no government shutdowns. People basically went on with their lives. And again, no vaccine. There were much less available options for therapeutic treatments. And, the economy rocked along and people lived through it. But basically, it was one of those situations where not a lot of protections and not a lot of ways to get through it. And here we are at COVID-19. Not much has changed. We have better therapeutics. We don't have a vaccine. Testing is inconsistent, but we're dealing with something that is really novel. And you've heard that over and over again, unprecedented. It's going to change a lot of the things, the risk factors that we look for in insurance and in liability for businesses far into the future.
Yeah. Obviously, we have such a mix, right? When we look at our chamber, we have a lot of brick and mortars. So that's like the obvious, right? You want to protect your assets. And then we have a lot of home-based businesses that maybe don't have as much interaction. How is there even a way to protect that small business that doesn't have that brick and mortar, that isn't face-to-face? Should they be, using some of that PPE as well? Because I feel like anytime I talk to someone that's more in that industry, they're like, it's not that big of a deal. Like,
Yeah. I think it goes back to just some common sense things. If you're interacting with clients or visitors or third parties, and it's impossible to do something in a digital or virtual environment like we're in right now, I'd say wear the mask and back up. So it's mask up, back up, wash up. the county put that notice out there. And I think it's very practical advice, and it's simple. It's something that we all can do. So the bricks and mortar businesses, there is a way for them to stay in this. And, we've seen this massive transformation in our economy, regardless of the pandemic. And has anybody heard of Amazon? So the ways that we purchase things, the ways we shop, those things are changing, and they were changing before the pandemic. Pandemic just sort of gave an accelerant to that. And so is it going to change the way that we work? So Brown & Brown's building an awfully big building down there on Beach Street, and we're hopefully going to fill that up with people. But is it going to change? And will you have some people that'll have modified schedules and will work from a home environment some of the week and then in the office other times? I think that's obviously going to change things. And travel is the big deal. Yeah. So, some folks can operate their businesses to a certain extent, but at some point in time, they're going to have to get on an airplane. And so, again, choices and risk mitigation and the very practical things, mask up, back up, wash up.
That's pretty much it. I mean, that's it. I mean, I know we're hearing it from all different areas. We're hearing it from the chamber. We're hearing it from the city. We're hearing it from the different municipalities. We're hearing it from, the county. We're hearing it from a state and federal level. I just feel like sometimes we just need to hear it from the people who we see day to day that make an impact and influence our businesses. Do you see, I know that there's not right now, we're not seeing a large amount of lawsuits, right? But do you foresee that there'll be those industry specific group lawsuits with this, because it's so up in the air? I mean, it's kind of hard to pin anything down. So a lot of those essential businesses that couldn't close and prepare for a reopen, that, continued to do business and kind of, maneuvered along the way and tried to change while they were still operating. Do you see that any of those businesses could be at risk in a big lawsuit against an industry specific field?
It's a possibility, Carmen, but, I think the real issue in Florida particularly is what happens with any kind of tort immunity or tort shield immunity or liability protection for businesses out there. So let's just say that we go into the next legislative session, which is not scheduled until 2021 in February. And so let's say that they get traction and there's momentum, and the election is behind us, and the legislature decides to come together and pass that kind of tort immunity or shield for certain industry groups or for individual businesses in the state of Florida. How do you make it retroactive without violating, someone's rights that exist today? So if you had one of those 301 lawsuits pending today as a plaintiff, is it possible to have retroactive tort immunity? In other words, take your claim away from you, even though you filed it now, and the tort immunity legislation doesn't pass until the spring of 2021. So the retroactive nature of that tort shield is going to be a big deal, because if it can't be retroactive, the businesses that are struggling through right now, what does it mean to them? It doesn't mean anything. If they're already being sued, those lawsuits will continue. So it may be too little, too late, which is a big concern for businesses. A lot of businesses have looked also at their workers' compensation exposure to their own employees, and they just said, look, we can't afford to have them come in because they're an essential business and expose workers, employees to COVID-19 and potentially get those kinds of lawsuits through either workers' compensation or outside the workers' compensation system. So it is a big issue. It's a big threat out there, and there are not a lot of answers right now. I don't know that all you can do is the most you can do reasonably to make sure that your workplace is safe because here's the problem for plaintiffs in pending lawsuits and in future lawsuits. Proving that you were exposed to COVID-19 at the workplace or at a specific business is a very difficult task because it's so highly transmissible. What's to say you didn't get it at the grocery store or a disappearing island over the weekend, or on and on and on. There are so many different ways, and right now the science can't tell you when you got it or where you got it. So that's the real challenge.
Yeah, so really what I'm listening and what I'm hearing, and really what I want to make sure that people understand is we're too far out to know that there will be some sort of blanket immunity for business. You don't know today, with the limited information that we have, whether or not you are protected, whether it's from an employee standpoint, whether you're protected from somebody walking into your business at all. You're just not a vendor, a supplier of some sort. So really, it is the mask it up, back up, and wash your hands. So I really just want people to understand it is so important. And, we become extremely complacent. That's just something, it's human nature. We talked about it a lot. And of course, even, before we started, I said, corporate told us we were really hoping to be out of this by July. Well, I'm anxious to be out of this, right? So we start to do things a little bit more like we were doing them in February, right? Maybe not taking that temperature at the front counter. We do that with all of our employees. Maybe not having them self-check before they come into work. Maybe we don't clean off the counter every single day like we did in June. So we just want to make sure that everybody is crossing their T's, dotting their I's, and just making sure they're very safe, because you don't know if anything that comes along later can protect you from what happens today.
That's exactly right, Carmen. And yeah, if you look also at what's pending right now, the Republicans in the Senate just put out their own HEALS Act proposal. It's, I guess, phase 4 of federal relief with regard to COVID-19. I don't know. I'm going to take bets on whether you think it passes or not, but part of that is there is included in there some liability protection for businesses. But again, if you're waiting for the federal government to come to the rescue, or even waiting for the state to come to the rescue, you may be disappointed at the end of the day. So your advice is spot on.
Awesome. Well, it's just every person that I bring on that we talk about this subject, whether it be COVID-19, whether it be the things that are happening, Florida is not just at risk right now of a global pandemic. We're also in hurricane season, and it's an election year, and there's so much stuff going on. So I tell people, and I hope that, sometimes as small businesses, we get so caught up in the day-to-day and just the operating of our business and just being in our business and not working on the business. And I tell people all the time, you need to work on the business, not just in the business. And working on the business is really being educated on these sorts of topics, understanding how that PPP works, understanding the legislation that's happening, understanding all these possibilities. I'm taking a ton of notes, just so you know, all these possibilities, and making sure that we are wise, right? At the end of the day, my business consultant tells me all the time, Carmen, your goal in 2020 changed. Your goal is to save the baby, and the baby being the business. So
that's right.
That's my 2020 goal. And I really want everybody else to really think about it like that. Think about saving the baby. We cannot make an impact in our community as small business people if we can't impact our business today. So
absolutely right.
Tell me a little bit about your involvement with the chamber, and obviously your chair this year, how you got involved and how that's impacted you as a business person.
Well, my involvement with the chamber goes back a long, long way. And I got involved with the chamber back in 1991 and was involved for about 10 years. And then took about a 10-year break. And this is my second tour with the chamber. So But I can tell you, I love the chamber. I value the chamber. It is so important to our business community in general. The things that it advocates for. So I'm kind of philosophically aligned. And as a new business person back in 1991, when I came back to town, it was one of the most rewarding ways to get involved and meet a ton of people across all industries that really share a common vision, that really want to lock arms and go in a positive direction in this community. So it's been great, and again, it's been a fantastic journey. 2019, we celebrated our centennial as a chamber. So it's incredible when you think about it. 100 years of influence and advocacy on behalf of businesses in Daytona Beach. And back in when my grandfather started his car dealership, or bought the car dealership on Beach Street, where the Brown & Brown building is going, in 1934, at the depths of the Great Depression, our chamber was still, it was in existence then and advocated for businesses like my grandfather's. And so here we are, we fast forward, and it's still doing the great things that it's doing. And I think look, again, I couldn't look in the crystal ball and say, would I have chosen to be chairman of the chamber and during a global pandemic? Maybe not. But I can tell you, honestly, my involvement with the chamber would have been no different. And I'm committed to making this, hey, we're going to make lemonade out of lemons. And this is going to, I know we're going to get on the other side of this. And I know that our staff and leadership in the chamber, Nancy Kiefer and the team at the chamber, have done such a magnificent job under incredible circumstances. And we're going to be better and stronger on the other side of this.
I love it. I love that team. I really do. I've only been here, or my business will be 3 years, August 1st. So I'm so excited about that. And the first thing that we did was join the Daytona Regional Chamber of Commerce. And they've been such a great part of the growth of our business. And of course, I appreciate getting to serve on the board under your leadership my first year here. So yay, I was very excited about that phone call. I won't lie. So excited to be involved and just to get to be under great leadership. And one of the things that I loved when you took over, when you gave your speech, was all the positive words about Daytona and talking about how we can change the perception of Daytona. And I'm a big positive words person. So that really spoke to me. And I just appreciate your leadership. I appreciate your time today and talking about this with me. And I look forward to seeing what the rest of 2020 brings for you as chairman and the Chamber of Commerce and our community.
Carmen, you're very kind. I appreciate it very much. And thanks to everyone out there for listening.
Awesome. Thank you guys. Join us next week. We have a new guest. And thank you so much.
Thank you.